And ladies and gentlemen, as our panelists take their seats, we all know that the climate crisis is a health crisis. So we've got the opportunity today to come together to discuss one of the most important topics in the international agenda with a very distinguished panel of experts. The COP28 Declaration on Climate and Health emphasizes the need to improve the ability of health systems to anticipate and implement adaptation interventions against climate-sensitive disease, health risks, response systems, and a climate-ready health workforce. Today, and here in this meeting, we are working to design and strengthen the health emergency workforce of the future, based on internationally agreed common practices and standards that can be adapted to local contexts. And that's what our initiative stands for. So we've now got the honor, and it's my pleasure to moderate this, to have with us leaders and representatives from different countries, from different parts of the organization, of the World Health Organization, from different organizations, to bring together their experiences. But before I move to the panel, I would like to pose a question to all of you. I would like you all to think about a word that better represents, or that represents an action and a priority we should focus to better address the impact of climate change and ensure countries are equipped and ready to rapidly respond to all health emergencies. So think about an action or priority that a country should do to rapidly respond to health emergencies due to climate change. There should be a QR code of Slido. You need your phone. And we'll come back to that at the end of the panel discussion. I'll give you 2 minutes. I don't know if the panelists want to get in there with a... I'll let you off if you don't want to. Okay, so keep your words coming, keep your inspiration coming. So it's now my pleasure to turn to Dr. Amal, Director of the Environmental and Occupational Health and Safety Department at the Abu Dhabi Public Health Center. In your capacity, you oversee several initiatives related to environmental health, occupational safety, and public health policies. The UAE is clearly a strong supporter of action on climate change, and you hosted COP28. You've been a leading advocate for climate action. How can the UAE leverage its role in global climate negotiations to strengthen the integration of health into climate policies, particularly in supporting vulnerable countries to build climate-resilient health systems and to be able to better cope with the increasing number of emergencies? Please.
Assalamu alaikum wa rahmatullah. Good morning, everyone. Thank you very much for the opportunity and the invite. It's really an honor and pleasure to be amongst this team and great number of delegates. And whoever is not from UAE, welcome to UAE, your second country, and welcome to Abu Dhabi. I was a member, I was leading the Abu Dhabi initiative when hosting COP28. So you're asking me about something that is very dear to my heart. UAE in itself hosting COP28 puts the country in a very pivotal role into the climate negotiation and climate action. The health nexus was first time introduced at COP28, which increases the responsibility of UAE in relation to the climate health negotiation. During COP28, 151 countries pledged and signed the climate health declaration, which will be followed up, and the action for this declaration will be followed up next month in Baku, Azerbaijan. So being the pioneer in bringing in the health nexus to the climate action, though not being it introduced for the first time in COP28, UAE started including the climate-related action into its policy building and development, I would say starting back in 2009. I was part of a study that was conducted in the UAE, which addressed the burden of disease due to many environmental factors, including climate change. And this study was updated again in 2023. So the inclusion of health into the policy reform is not new to UAE. It just was emphasized during COP28 to emphasize the role of the governments to bring up the health into all climate action. Climate change is a cross-boundary threat. It knows no boundary. Any climatic-related event in one part of the world can impact the rest part of the world. Any adverse weather event happening, for example, in Pakistan, for example, can impact like the floods that happened last year in Pakistan, can impact not only neighboring country but the whole world, because you know, it's as we are all talking about, it's all hazard one health. So any outbreak due to a vector-borne disease, due to a climate change that impacts the life cycle of certain vector disease-transmitting vectors can easily be transmitted to the rest of the world. So the emphasis or the speaking of health nexus in the climate in the COP28 was just the introduction for a collaborative effort worldwide. In addition to that, we have, so the addition will promote the climate nexus. In addition to that, UAE has been playing also a great role in supporting vulnerable countries. We do have really great expertise in the UAE who can support the capacity development and building in vulnerable countries. Also facilitate the knowledge sharing in these countries, and advocating for climate finance. UAE is investing in many parts of the world to reduce the impact of climate change. For example, the mangrove planting in Indonesia, for example. This is not only an environmental initiative. This initiative aims to reduce the impact of greenhouse gases emission around the world, therefore decrease its impact on health, and therefore also contains the potential emergencies that could emerge from the climate change. Additionally, as I said, we are investing not only in climate-related actions, but we are also working proactively in surveillance. I am a member, I'm a public health professional. I'm a member of Abu Dhabi Public Health Center. Surveillance is the backbone of our business. So the close monitoring of environmental factors really supports the emergency and disaster planning and management. So the close monitoring of all, I would say, environmental pollutants, emerging viruses, vector-borne diseases, will better position us worldwide in preventing what is preventable. As Dr. Ellen said, expecting the unexpected.
Thank you very much, and we'll continue to need your leadership in pushing for that climate and health nexus. And indeed, what you say is not just that climate change affects us all, but it's also the impact then has an effect on all our countries. And it's my pleasure now to come to Her Excellency Ms. Lucy Berger, the Ambassador of the European Union. You've got vast experience of negotiations relating to climate change and the implementation of climate measures in trade policies, reinforcing the EU's commitment to sustainable practices. So the EU plays a coordinating role in addressing many cross-border health threats, including those associated with climate change. What strategic action has the EU taken to address this and to prepare for future health crises? So around that nexus, please.
Good morning, everyone, and thank you very much for inviting me here. I feel really humbled. While I do have some experience in climate negotiations, of course, I'm no health practitioner, so I probably have the least experience from everyone in the room. But I'll try to explain what we do and how we prepare for the crisis, and also how we cooperate with our partners. I'm not going to lecture about the impact of climate, of course, beyond weather, but on everything else. And I also want to actually congratulate the UAE leadership during COP28, because you really did point at all the sectors that will be affected by climate action and already are, including health. And I think these were very important conversations to be had at the international level. Just as an example, the extreme weather events have killed about 500,000 people over the last 2 decades, and these are completely avoidable deaths, which is something that we've started noticing and focusing on also in the European Union, how to prevent it and how to avoid it. Now, in the European Union, the health policy actually is rather complementary to the action of the member states at their national level. On the climate side, we developed a European climate risk assessment, which pointed out especially to the risk to the human health from heat stress, and that it would be especially severe in Southern Europe in particular. Now, I know I'm in UAE, and here, 40, 45, sometimes even 50 degrees temperatures in the summer are quite usual, but in Europe, we're really not prepared for this. We're not adapted, and when the heat wave hits us, and we don't have air conditioning, most of us at home, it is actually really serious, and it affects people a lot. So just in the summer 2022, we had 60 to 70,000 premature deaths due to exposure to heat in Europe. We've just had the worst flooding in Spain, with actually a lot of unfortunate death as well. And of course, we see increasing transmission of infectious diseases also due to the changing climate. So already in 2013, we decided together with the member states on serious cross-border threats to health, where we tackled such cooperation as during pandemics, or during chemical, biological, and environmental events, which of course cross borders, and especially since we have the free movement in the Schengen area, we really had to start looking into these collaborations more seriously. This collaboration has been adapted through the course of the decade, and most recently and most importantly, I'm going to say, following COVID-19 pandemic, which of course hit us all a lot, and it was a turning point for us. So we started focusing on anticipation and response to health-related threats. What we've done is we've created a Health Emergency and Preparedness Authority, so-called HERA, which we use for gathering intelligence and for building response capacity across the member states. So that's really an EU effort. We secondly have launched in 2021 the European Climate and Health Observatory, which again, it helps us to track, analyze, and prevent impacts of climate change and health. So this really is very specific for the climate and health connection already. And of course, we foster also through this observatory collaboration, not only across member state authorities, but also with many other relevant actors. And then finally, money. We have currently the EU for Health program, which is the largest EU health program so far, to strengthen health, to be prepared for health crisis, and of course to strengthen the health security. Currently around 5.7 billion euro actually to complement action already at the national level through different envelopes. So this is what we do across borders. The question was across borders within European Union, but of course there's also cross-border collaboration externally for us, and we cannot forget the health of, especially following COVID-19 pandemic, that has to be a global effort. I want to first of all commend our collaboration with WHO, of course, that's a key player for us, and the multilateral collaboration is of key importance. I do not want to highlight any of the good examples and results that we've had with the World Health Organization, but I want to point out the whole of society approach, which I think is very important to basically tackle, like we did during COP28 here in Dubai, different layers in the society and bring different sectors together. In our external policy, we also have a strategy, so-called Global Health Strategy, where we have something similar. It's One Health approach, and we bring together not only the human health, but also animal, environment, and climate, and we have one strategy to that, so that we don't create a disbalance, but by focusing only on one of the aspects. Of course, we supported and endorsed the COP28 declaration on climate change and health, and are looking forward to working on it closely also during the next COP. And for example, we're scaling up our humanitarian aid, and I think especially the focus on disaster preparedness, because with climate really affecting not only health but also security, and we have also the climate and security approach, we have to take into consideration in the preparedness increasingly epidemics, displacement of people, and impact also on mental health of the changing climate. And finally, if you allow me to bring it to the region, something that I do here on a daily basis, we've had the EU GCC summit in October, very first meeting of the heads of state and government, and our cooperation on actually health and also disaster preparedness was one of the highlights there. And we've agreed to create a structured cooperation between the EU Emergency Response and Coordination Center and the GCC Emergency Management Center. And I think these kind of structural collaboration and exchange of information is also key for us to be able to tackle these cross-border, and I'm also going to say in case of climate, global crises together.
Thank you very much. I think very important points. We need all the allies, but I think the EU role is vital, both cross-border within the EU, but also the support to the disaster response, also outside of the EU. So don't think you don't belong to the community in this room. We need you. So I'm gonna apologize to the script. I told everybody to sit where they want, but I'm gonna keep to the scripted order. So I'm gonna jump to two gentlemen ahead. And it's my pleasure to introduce the Secretary of Health, Dr. Teodoro Herbosa from the Philippines, as our next panelist. He's got expertise in trauma, surgery, and disaster medicine, and amongst the many achievements we already heard a little bit about Typhoon Haiyan in 2013. You coordinated the foreign medical teams, showcasing your commitment to public health in times of crisis. Now, your country, the Philippines, is highly exposed to climate-related hazards, including the typhoons and floods. What strategies at the national level is the Philippines implementing to protect public health from these increasing climate threats? And then also in your region, how can the regional cooperation in Southeast Asia enhance these efforts?
Yes, thank you very much. Actually, the Philippines is very lucky. Most of the Western Pacific Islands are very lucky because over the years, we've been hit by climate activities. Almost 20 typhoons hit my country every year. The problem is with climate change, the typhoons have become stronger. The rains, the most recent one was just a tropical depression, and it flooded most of the northern islands. The amount of rain that fell on the northern island, Luzon, Bicol, was double the last one in 2007, which was the strongest, Typhoon Ondoy, a typhoon. So basically, we're vicariously living this climate change in the Philippine Islands, in the Pacific Islands, because this is where the strong climate change has happened. But luckily, as we move from a low-income country to a middle-income country, we've also learned to save lots of lives. I remember in 2006, because of the frequency of the typhoons, the UN started this cluster approach to disaster response. International teams coming to a country that's devastated by climate activity, and we were able to organize international teams based on their cluster, one on housing, one on food, one on health, one on economics. And this became a standard in the way we actually took. This happened after a volcano erupted and a typhoon came in November of 2006. So the first time the cluster approach was actually used was in 2006. And after that, it became a standard. The second time that the story evolves is in 2013, also in November. Typhoon Haiyan hit the Philippines, and many of you, even our keynote speaker, was in Tacloban, one of the islands that was hit. And this was the first time that a manual called the FMT classification of foreign medical teams was actually implemented as how it was written in the manual. I knew that because I was the undersecretary in charge of the disaster response of the international teams. So we had two pictures, a picture of an earthquake in Haiti and a picture of a super typhoon, the strongest typhoon ever in the world, hitting 7 island landfalls. And the stories were completely different because we applied the FMT classification. So this, I think, is the birth of where our EMT classification today happens. That's why I'm particularly proud that when I came here and we got awarded 3 emergency medical teams certified by WHO, that idea came out of the fact that many teams descended on the Philippines, yet their capability was unknown. There was a language barrier. They couldn't actually coordinate with some of the local teams. And it was a difficult task for us in the government to actually organize that. It wasn't easy. So I said, why do I have to pre-classify, get the certificates of all the doctors and the members of a team to come to my country when it's already an emergency? So we said, maybe people should be classified as teams already by WHO, so that when they say go, Mercy Malaysia, Singapore, my neighboring countries do not have to go through any more process because of certification. This is what we have done. The other thing that's very important that my message is that how the country has learned over the years to live in the Pacific Ring of Fire. And it's because of a mindset and a culture that the typhoon can come, the floods can come, an earthquake can come, a volcano can erupt. Yet we are resilient because of one word we call bayanihan. That's called, I don't know what the English translation is, but our colleague from Europe said it's the whole of society approach. Bayanihan, translated, is the whole of society approaching a particular problem. And this is the message we have now for the other island nations in the South Pacific, Western Pacific that's really affected. It's not about resources, it's not about, but sometimes it's the mindset. It's the mindset of an Olympic champion that gets a gold medal. It's the mindset to survive. So this is the important part. Yes, of course, we need the technology, we need the supplies, information, collaboration, cooperation. That's very important. But when the impact of climate change happens, what is important is the actions taken by your neighbor, by your friends, by your people around you. And if people are educated, people know what to do, there will be more lives that will be saved. And that's our experience. So I'm comparing things happening in Valencia with the hundreds of people dying from the floods there. And I'm looking at, my country said, we were a colony of Spain. How come we have less deaths in a situation of flooding in the Philippines? So this is something we need to share. Next month, we are having the Philippine Pacific Initiative Conference in the Philippines. And we're trying to share our experiences. Most disasters happen in countries that are land-based. Their experiences of the rich countries are in land-based. Very few are island-based like mine or archipelagic. And we're now beginning to share our experiences of how we survived the Pacific Rim of Fire to our Pacific Island colleagues. Thank you.
Thank you. Thank you, Secretary Barbosa, and really fantastically inspirational around the role of this initiative in addressing the climate crisis, but also reaffirming the whole of society and approach that we need. So I'm going to jump back to the Undersecretary from the IFRC, Mr. Xavier Castellanos Mosquera, who has more than 3 decades experience in the national society development, in resilience building, and in emergency operations. IFRC is and has been at the forefront of so many humanitarian responses. So how is the Red Cross, Red Crescent movement adapting its operations practically to address the increasing frequency of climate-related disasters? And how can the organization enhance community-based resilience in vulnerable regions? So what are you doing to prepare and respond?
Thank you very much, and thank you for the invitation. If you allow me, I would like everyone to zoom in right now to the individual first, to yourself, to many individuals around the globe that are affected by disasters and crises. And zoom in and focus on your family. And when you see yourself and your family, I would like to put climate as a topic and how climate can affect the well-being of your family or your own self. And the impact of climate in health, in water, in sanitation systems is extremely high. And that impact immediately goes to you, to your family, to you, to your individual. The systems, when are affecting at the same time, when crises happen, the mental health is high. When the systems of the supply chain for food creates food insecurity, impacts highly in communities. So I would like to put people center first. When we talk about climate and when we talk about resilience, the first level of resilience happens at the individual and family level. And there is where is needed an investment. But when we go to community itself, what we are looking at is a very different picture. Because many times what we see is the indignity of the hunger. Many times climate affects either because weather-related reasons or human-induced reasons, what we are seeing, the indignity of hunger. And local communities are stretched. When we talk about heat waves in urban cities, we face the loneliness of those who die in their own building apartments. When we look into livestock, when die by millions in Mongolia, for example, for cold waves, we see how the livelihoods are being destroyed. So I would like us to look on how climate impacts first individuals, families, communities. And when we look into the communities, and then also let's look institutions. Institutions responding to climate events that are multiple events happen all the time in countries, where multi-hazards are there, where polycrises are there, the systems are weakening, weakening, and weakening. And how to deliver humanitarian services in such conditions when many local communities are not able to maintain themselves capable. So then comes the issue about what is the action about community-based resilience, institutional resilience to address issues related to climate. And when we talk about action-oriented community resilience, what we are referring is at least on what we call first the preparedness side and the adaptation capacities. What are our preparedness based on our engagement with local authorities, with national authorities? And what is our community-based team's capacity to deliver services? The second, one good example on climate-related is what we call the CP3, which is the Community Pandemic Preparedness Program that we have in 30 countries. That means community-based actions teams working with communities. The other one is what we call the anticipatory action. And when we talk anticipatory action, be for climate-related or disaster-related, the anticipatory action helps to avoid major destruction and also helps to protect livelihoods. Because again, connecting, if you lose the livelihood, look again at to your individual or your family what happened. If you protect the livelihoods, look what the systems will work. Institutional systems as well being protected is going to make a huge difference. And in large-scale disasters, what we have is our emergency response units as well. We have 8 types of emergency response units able to be deployed at any time. The issue is how not to use it. How not to use it if we invest in community resilience, institutional resilience. And that is the critical component. And finally is the issue when we talk about recovery. Do we plan recovery with sustainable thinking, mindset? How do we ensure that infrastructure, let's talk about health infrastructure, is strengthened in conditions that we don't recreate risks, that we don't put infrastructure systems where vulnerabilities exist, and that we create the right mechanisms to guarantee that the conditions are in place. And finally, our move in the culture of working has to do with greening our response. How we can guarantee that whatever we do has a focus on greening our operations, ensuring that we use environmentally friendly goods, environmental friendly actions that allow us to guarantee that we don't increase we manage to reduce the greenhouse emissions as well. To conclude, in the case of the IFRC, we have our climate resilience platform. We aim to reach to 100 countries, the most vulnerable climate-related countries around the world, the globe, 500 million people to be reached by 2027, and focus in 4 key major areas. One, around climate adaptation, anticipatory action, and preparedness. Second, climate and migration. Third, climate and health. And 4, climate and nature-based solutions and food security. So just the call of action is about resilience building has to be seen with a focus on multi-hazard mindset. Thank you.
Thank you very much. And so a lot of very important points there, but really around thinking about the impact and mitigation to climate change right through the whole chain of our activities, as well as, of course, the resilience of the system within which we operate, right, with the teams and as responders. And it's now my pleasure, so I'm going to jump again to Dr. Rick Brennan. So we've already heard Rick is a Regional Emergency Director for this region, a senior manager and physician with very extensive experience of the emergencies here and worldwide. Looking at this from a regional perspective, how do you see the integration of climate actions and measures to WHO's efforts to strengthen emergency preparedness and response?
Well, thank you very much, and really wonderful to be here. If I may, can I just share a couple of reflections on how astonishing the growth of the EMT initiative has been? I mean, we've heard from a number of people, a bit of a historical perspective, but you know, our colleague from the Philippines was talking about the Blue Book, and the first Blue Book, some people may not know, was the Foreign Medical Team's Blue Book. It was designed with the concept that we may bring in foreign medical teams perhaps following acute natural disasters, learning the lessons of what happened in Haiti. And as you said, the first time we really applied that was Typhoon Haiyan in 2013 in the Philippines. But then in 2014, we had Ebola in West Africa, and we deployed foreign medical teams to a disease outbreak. And disease outbreaks were not covered in that first Blue Book, nor was conflict. And we saw these gaps in medical services in conflict, so we pushed the EMT initiative. What about a Red Book? And now we've got 16 EMTs deployed in Gaza and 6 in Lebanon and soon for Sudan. And then we realized, well, this isn't just about foreign medical teams, this is about emergency medical teams. And so the national teams became a bigger priority, and the role in preparedness. So, and then to hear Flavio today with the Vision 2030, every country, everyone, I mean, it's amazing, just amazing to think of how far we have come, and of course, too many people to acknowledge. Geert Gies from Belgium's here, and Len playing his vital role, and Ian Norton, who we've mentioned, and Flavio himself, and Mike, and, you know, just too many people, but extraordinary to see. I would never have thought we would be here with 131 countries represented. So sorry for that little sidetrack there, but so our region, we are like the Western Pacific, we feel we're very much in the eye of the storm for climate change as well. So the over 2022-23, of the 10 deadliest natural disasters in the world, 5 of them were in our region, 2 of them were climate related. The floods in Pakistan and Storm Daniel in Libya, which resulted in dam bursts and floods. In fact, of the deadliest natural disasters worldwide for the last 20, 25 years, a report came out just a few days ago. The deadliest natural disaster was, again, in our region, in Somalia. It was the drought in Somalia in 2012, which took over 250,000 lives. We're also seeing the spread of infectious diseases, dengue. We have 8 dengue outbreaks going on right now. 3 new countries affected this year. Cholera, 9 cholera outbreaks, 2 new countries affected this year. So we feel very much in the eye of that storm. And of course, we have 9 of our 22 countries are classified as fragile and conflict affected. 13 of our countries are low, middle income. So very challenging environment. But I think we need to take a little bit of the mystique out of the planning for climate-related emergencies. I think we've heard from a number of speakers how important good, comprehensive, all-hazard emergency management is for preparedness for emergencies generally, and certainly very relevant for the climate-related crises. So we want to be working through all phases of the emergency management cycle: the prevention, the preparedness, the detection, the response, the recovery. We want to get the basics right. Let's do our risk assessments using the STAR methodology or whatever. We need to work out, assess what are the highest risk hazards and events, and do our planning and preparedness accordingly. I do think in that process, WHO's Health Emergency Preparedness, Response and Resilience Framework helps us think that through. Do we have the basics right? Do we have our coordination mechanisms? Do we have a functioning EOC? Do we have a multi-sectoral and network? Do we have the right partners on board? Do we have the disease surveillance in place? The countermeasures and the stockpiles. It's been interesting, again, the evolution in disaster management and emergency management over the years, the increasing focus on clinical care. So the EMTs, rapid response teams, do we have all those preparedness measures in place? And then, of course, as the colleague from IFRC said, the community focus, the prepared community. And we talk a lot within WHO now about community protection in the context of, countries that are prone to drought. Are our communities resilient for that? Do we have in Somalia today a high enough coverage for measles, for vitamin A? Do they have access to basic primary care? So this is, I think, some of the thinking that guides us. Of course, we're very much in response mode and need to do more on the preparedness and operational readiness all the time. I think related to that, again, we've got our, in our region, we have a good generic platform for emergency response and emergency management. We have our emergency response framework. We apply emergency management best principles, the incident management system, of course, but we also feel increasingly we need hazard-specific guidelines. What do we do differently in a flood as opposed to a cholera outbreak, as opposed to an earthquake, and so on? So these are tools that we are in the process of developing. So again, good, comprehensive, all-hazard emergency management, I think, forms the basis, and very much having that community focus. I think the prepared community, the resilient community is absolutely vital. So maybe I'll just leave it at that.
Thank you, Rick, and also let me say thank you for the reflection on the history of the initiative, as well as your reflections on the need for preparedness and the all-hazard approach, and also highlighting that even with the EMTs, I think the international response and the national response are so very closely related, and I add my thanks to your long contribution to all the work that we do. So thank you. So I'm going to jump back in terms of the order of seats to my friend and colleague, Dr. Wessam, He's the acting head for Emergency Preparedness and Response Division at Africa CDC. He's also from this region. There's no doubt, Wessam, that climate change is also increasing the vulnerability of Africa's ecosystem, accelerating the spread of diseases. And there are many of the countries on the African continent, Mozambique, Madagascar, they're very much affected by many of these changes, but across the region. And we already heard some examples, also country examples from Rick. Which concrete actions will Africa CDC, as the regional CDC for the African continent, prioritize to tackle this?
Thank you so much, Professor Joanna. Let me start first with thanking my brother Flavio and WHO for organizing this amazing gathering and bringing EMT from across the world, and thanking also United Arab Emirates for hosting us and for the generosity and welcome spirit that we touched since our arrival here. But let me also start with asking a question. What are the two most frequent quotes that we keep hearing during COVID-19 time? There are two most frequent. Every now and then in media, political leaders, public health leader will keep repeating those two quotes. First one, disease, pathogens, no border. Second one, no one is safe until everyone is safe. The same apply for the climate change crisis that we are facing. No one is safe until everyone is safe. And climate change also no borders. This is why my colleague started with, we need to have a collaborative approach and collective responsibilities, starting from individual level, going to the communities, then going to country level and regional level to address climate change crisis. And remember that climate change is like sleeping dragon. Climate change is like sleeping dragon. When it awakes, the earth will shake. So our rule to keep close eye on this sleeping dragon and do whatever we are able to do to prevent this sleeping dragon from being fully awake. Because when it awakes, this will lead to shaking of the whole earth. Unfortunately, although Africa is the least contributor to global greenhouse gas emission, less than 4%, but we still were among the most affected continent when it comes to the consequences of climate change. This includes a lot of vector-borne disease outbreak happening in the continent, flooding crisis happening in some of the countries, in addition to unpredictable weather conditions that is keep going in different countries and affecting different of our member states. But let's move from diagnosing the situation. And you mentioned in your opening remark, Joanna, climate change, this is the greatest challenge of our time. But although this is the greatest challenge of our time, how can we move this greatest challenge of our time to be the greatest opportunity for global health? And let me start from Africa CDC. We currently have consultative meetings with different partners to form our climate change and health strategy framework for Africa. And this framework will be covering 5 main pillars. First one, leadership, political commitment, and advocacy part. And we are building on one of the competitive advantage for Africa CDC. We are embedded within a political organization, African Union Commission. Currently, Africa CDC, at the top of our governance structure, we have 10 heads of state and government. So how can we leverage having access to heads of state and government, either through the Committee of Heads of State and Government, and also reaching directly to the Assembly for Heads of State and Government to advocate for climate change policies that is supporting One Health approach. This is one. Second, early warning. And this is, we need now to start doing mind shifting in public health organization. How can we move from disease surveillance, tracking cases and counting cases, to look now for surveillance for threats. And at the core of those threats is climate change threats. So this is mind shift that we are start doing now, tracking different meteorological events, tracking different threats that is happening also in zoonotics that may have impact, not to wait for disease to start affecting human being and start counting those. So this is second part, early warning through mind shifting from disease surveillance to threats and risk surveillance. Third one, building the capacities at different level, country level and regional level and continental level for emergency preparedness and response. And here we have two main initiatives we're pushing for our member state. First one, Emergency Operations Center. This is where we are keeping a close eye on those sleeping dragons. This is Emergency Operations Center, we're pushing this agenda at national level, at regional level, and continental level. Our target, following Lusaka call to action, where we have a meeting for all heads of state and government, and they committed by 2027, all our member states in the continent to have their national functional public health emergency operations center to keep close eye on those various threats. Second, AVOC, African Volunteer Health Corps. Now we are shifting from rapid response team focusing on public health to expand the AVOC scope to include emergency medical team. We just concluded the first consultative meeting for emergency medical team in the continent. We'll be continue to advocate for all our member states to have their national emergency medical teams. Congratulations for Senegal to be the first one, but hope within the coming 5 years, at least 90% of our member states to have their classified emergency medical teams. And fourth one is equitable collaboration. Again, this is not a Ministry of Health problem. We need collaboration between different sectors in the government. We need Ministry of Health, we need environmental health, we need animal health as well. And finally, the fifth pillar, action-oriented partnership. We'll be reaching out to all partners to be embedded in this strategy for Africa for climate change and health, to get action-oriented partnership, to move those targets into reality. Finally, as a pandemic, as what is called pandemic Alzheimer. Do you remember what happened in 2002? 2002, we had SARS outbreak in several countries. 2009, H1N1, 2009. 2014 was Ebola outbreak in West Africa. Then COVID-19. So at the heat of the outbreaks, at the heat of the pandemics, everyone remember. But once it passed, we have this, what is called pandemic Alzheimer. We tend to forget what happened. My worry that we are moving also, similar to pandemic Alzheimer, to have climate change Alzheimer. But the risk here with climate change Alzheimer, we are taking the first steps toward our destiny. We're taking the first step in the road for our extinction. Thank you.
Thank you, Wessam. Thank you, Wessam. And it's great to hear the tangible steps that Africa CDC is taking with the action plan. And I like the ambition of the 90% with the teams in 5 years. So climate change is directly, and this leads me to my next speaker, to our next panelist. Climate change is directly contributing to humanitarian emergencies. Obviously, that's why we're here. That's why we're having the discussion. But climate change, health, and human mobility are also closely connected, right? Those emergencies are closely connected to population movement and migration. And it's my pleasure to welcome now Dr. Santino Silveroni, the Director of Migration and Health from the World Health Organization, who's dedicated his work in global health really to health sector reform, health system strengthening, but also really leading the global work of the organization on health and migration. So Santino has said climate change is increasingly displacing people. How does the displacement in climate change affect health? And what should be done at the global level? So what are you doing at the global level, but what are you also recommending to the collected panel of leaders and the room here? What should be done at the global level to address this dual impact?
Thank you, Giovanna. And let me try to start by stimulating a little bit thinking. As we speak, we are counting a bit more than 1 billion people on the move worldwide. 250 million roughly are international migrants. Displaced refugees, they grew to 120 millions from 2020 to 24. So it's the largest growth of displaced population because of crises and conflicts around the world. And we are estimating a bit more than 750 million internal migrants. So when we look at the root causes of those population movement, socioeconomic reasons remain the main one, but the second one is climate changes. So very difficult to address solution in climate changes if we are not in parallel addressing also population movement. And conflicts and crisis is the third main cause for putting people on the move. If we are then disaggregating those data, those figures, and we look into the correlation between population movement and climate changes, only in 2022, because of acute climate phenomenon, about 32 million people has been displaced. And the estimation by 2050 is that we might confront with a movement of 120 additional millions because of climate changes. So this required not only having clarity and efficacy in addressing humanitarian response, saving life, but also start to look in a long-term perspective. Now, when we look at the long-term perspective, it's quite amazing to see that if we're going to look at the mechanic, the intersection between health, migration, and climate change, we have a lot of gaps of knowledge, a lot of gaps of understanding how the multi-factor are interacting among them in influencing then the health outcomes. That's why the necessity to invest into research, operational in the moment of emergency response, but also routine research in order to clarify situation, to collect evidence and data to support policy and health system shaping up, because long-term aspect requires structural changes in order to increase resilience and capacity of the health systems to include population like migrants and refugees, particularly when we're talking about international migrants and refugees, so they are people which by definition are crossing borders, so they tend to utilize services across borders. Then there is another element. When we look at the long-term aspect of health, migration in the context of climate change, we need to know that migration as an adaptational phenomenon is already taking place in some times and is a silent phenomenon which is putting on the move communities in different parts of the world. And when we try to understand better the situation, we reveal that while we are having more precise, more accurate data on the acute phenomenon, for example, there is a wonderful initiative of UNHCR in trying to map the area and the vulnerable population, refugees population affected by climate change. This is displaced in the front line of climate change, the name of the initiative. We do know much less in terms of long-term movement of those communities, those populations which are already migrating across borders very often because of the climate changes reasons. And when we connect this with the health sector, with the public health aspect, with the health system, we see that there is a disconnect. We are not yet following the adaptation that those communities are undertaking, and we don't have an health system which is following this adaptation, coming up with innovative solutions or strengthening capacity in order to increase resilience and inclusiveness. It's interesting that most of those areas are located in a sort of tropical belt, regions which are already suffering a certain degree of vulnerability, and the area which are interested by cross-border migration as adaptation to climate changes are often rural areas which are underserved by health services or they don't have health services. So for example, we are quite behind in promoting inter-country discussion, inter-country collaboration try to share services across the border or healthcare workforce across the border, or to have mobile solutions in order to serve those communities. In terms of research, it's interesting that we just launched last year a global research agenda on health and migration and displacement, and looking also at the element of climate change, was quite interested to see that currently 97% of the financial resources provided to research are directed to high-income countries. So this means that most of the ongoing worldwide research of what's happening, or what are the interconnections between health, migration, and climate changes, is a result of, if I can call it, in vitro research from high-income academic institutions located in high-income countries. We believe it's very important to really balance this unbalanced situation by targeting and involving community which are interested by the migration as an adaptive phenomenon to climate changes, because in many of those communities, those are phenomena taking place already by a number of years. So there is a lot to learn, and important to involve countries where the migration with the phenomenon is happening also in the research. Data, it's probably a crisis within the area of health and migration, because first of all, there is no routine data collection, a disaggregation of data when we are talking about mobile population in many countries. But then data research on the health, migration, and climate change is just at the beginning. So this is very important. It's a gap which needs to be addressed, and much work is needed, because effective data, reliable data, are important to support the policy discussion and health system setting.
Thank you very much, Santino, and important points there also on the importance of data, and also with that increasingly emerging is of course the impact of NCDs also at that nexus. Very interesting. So we come to our last speaker, and last but not least, I should say. So Dr. Mike Ryan has been at the forefront of managing acute risk for the last nearly 25 years in global health. We are here part of the health emergency workforce. We want to be part of a stronger and interoperable health emergency workforce. Which actions should we take specifically as part of that workforce to mitigate or address the impact of climate change in health? Mike.
Great. Can you hear me? Yeah, I think so. Okay, the interesting thing about climate is that it itself, or climate stress, creates vulnerabilities in itself. It actually is a threat in itself. It decreases the capability of the system to respond to that threat. So it has these multiplicative impacts. I often refer to climate, conflict, and contagion. If we talk about what Santino spoke about, the Sahel and other places in the world. And I think, just before I come on to say something about the workforce, there is no developing world anymore. The developing world is moving on and achieving huge strides forward in health. But there are 30 to 40 countries, and Rick will attest to this, that are literally separating from the rest of the planet in terms of vulnerability, climate stress, conflict, displacement, lack of governance, so many other things happening. It is in these countries by 2030 where 85% of the poorest people will live. It's in these countries that 70% of high-impact epidemics will occur. It's in these countries where half the children who die under 5 will die. It is in these countries that 2/3 of women who die in childbirth will die. So the world is no longer north-south. It's no longer developing. It is all the countries on one side that are in some state of development and progression, and countries that have been entirely dislocated from the development cycle and are mired in humanitarian crisis, in repeated polycrisis happening again and again. And this is going to be the challenge, I think, for the EMT movement in future. Yes, there will be disasters, and sadly what we saw in Valencia and others, and my heart goes out to the people who suffered there. and other crises, and Flores Island and the volcano, they will happen. But when we talk about the overwhelming majority of human suffering that will occur over the next 100 years will occur in 35 countries. That's the reality. And the EMT movement has to adapt to that in terms of having a surge workforce both within those countries and an international workforce that can come to those countries in order to be able to deal with that. So there's both a need to respond to national climate stress, but there's going to be a need to surge into and support countries that are really going to really have a very hard time in the coming years. There are also people who look through the various lenses. Some people will look at health emergencies through a temporal lens: prevention, preparedness, readiness, response, recovery. Some people look through a managerial lens and say we need financing and we need governance and we need systems. Some people will look through a threat lens and look at biosecurity or look at natural disasters or look at conflict. Some people will look at a capability lens and say, what are the capabilities we need? We need surveillance, collaborative surveillance. We need a scalable clinical care system. We need community protection. We need access to countermeasures. We need coordination. And you could have people having arguments at cross purposes. But no matter which way lens you look at, workforce is central to our capability to deal with emergencies in future, and particularly on climate. There is a bit of frustration out there. I was at the G20 last week, and a lot of ministers, health and finance ministers, and a lot of ministers were asking me very directly, not what our policies were, not what our approach to mitigation in the long term was, or adaptation, or putting solar panels on hospitals. They were asking us, what are you doing right now to actually assist people who are suffering in the existing climate crisis, not the one in 2030, but the one that's affecting hundreds of millions of people now. And I think that's where the EMT movement and the surge capacity has the real chance to make a difference now, to be in the field now. But to do that, given the different crises that we face, and I think, Johanna, you've spoken to this as well before, bringing together the different capabilities we've developed. The Global Health Cluster was developed to bring NGOs and the UN system together around health and humanitarian crisis. The EMTs movement came together to be able to project human resources and in the clinical sphere into the field. The Global Outbreak Alert and Response Network came together in order to be able to deploy public health expertise around the world. We have different networks that have been developed and deliver very, very well against the objectives that were set. But the world has got very complex, and we have to be able to now cross-fertilize those different platforms, because a number of countries who want to develop national response capability can't develop an EMT and a GORN and something else and something else. They have to be able to develop a composite, integrated, rapid response surge capacity within the country. And I think that's where the challenge is going to be for the Global Health Emergency Corps. The Global Health Emergency Corps is nothing more than the ecosystem within which all of these massively important networks exist. It's really important that we forge a way forward with our political masters and demonstrate to them that surge capacity for health response is not just a series of little groups trying to do their thing, that it is a global movement, that this movement is central, because there will be lots of capital investments in health systems to be resilient against climate stress in the next 10, 15 years. The real tragedy will be if we don't see workforce as the central pillar of climate resilience in the health system, not bricks and mortar. And the EMT movement is fantastically well positioned to take advantage of that. You're ready for takeoff. You're more than ready for takeoff. You're exactly where you need to be right now. So it's more encouragement, Johanna, than advice. But I would really encourage, and I know the EMT movement has been a real leader in this, in leading out and bringing all of these different networks together under that umbrella in order to be able to demonstrate to the donors, demonstrate to countries that we as surgical capacity in health are ready to respond at a moment's notice. Thank you.
Thank you. So a real call to action for how the EMTs fit into this already facing us climate threat. And we've got the words up here from the slider we asked at the beginning: preparedness, resilience, awareness, training, collaboration. I think we're doing all of them, right? We're doing all of that. So I think I'd be grateful if you could join me in giving another big round of applause for a fantastic panel, so many rich perspectives.